हाँ लक्ष्मण, हेलो हेलो हेलो. So, yes, students, I am audible. So let me just check. Okay. So before starting, I just want everybody, I am audible so that we can start the session smoothly. Please let me know, my dear, those who are live. Okay, okay, okay. So yes. So yes, so I am live. So we can start the session now. Now it's important that so this is the session. Firstly, I would like to just give my best wishes to all. And the anatomy question was not very tough. It was all from the previous topic which has been taken on the platform, and it's very easy one only. I can tell it's very easy. It's a moderate level because few questions are from the previous topic, few questions are previous anatomy repeated question which we have discussed in the test and discussion also. So I want so what I have done, I have collected many of the anatomy questions from the students from the Telegram group and all. So after few 2-3 days, we will have a detailed discussion also, but it is also in some way or some other respect in a detailed form only. Approximately, I gather 2021 anatomy questions. So let's discuss one by one. So let's start with this. And if you want to add on anything, any options or any other question which you feel, you can just write in the chat box. Okay. So let's start with this session. So the first MCQ which I want to discuss related to the anatomy subject was, which of the following structure is 25 centimeters distance from the central incisor teeth? So the option which the students were telling was 4, cricopharyngeus, arch of aorta, the right main bronchus and the diaphragm. So we already have discussed this, and we are knowing the constrictions of the esophagus is occurring at a 4 level, and the distance from the incisor teeth should also be known to you. So if I am talking about the 25, what is the crux point which is given here? 25 centimeter distance from the central incisors. So absolutely the correct answer will be arch of aorta in this case. So we'll mark arch of aorta in this case, and I feel many of the students has already marked this as a right answer. They have marked arch of aorta as the right answer. Is it okay? So now the thing is that I would just give you a quick revision that you should know the vertebral levels. What is important for you is to know the vertebral levels of these constrictions. So esophagus is constricted at the level of cricopharyngeus junction. It is constricted where the arch of aorta is crossing. It is constricted where the left main bronchus is lying, and also at the esophageal hiatus of diaphragm. So these are 1, 2, 3 and 4 constriction. So approximate distance, if I talk about, I'm just enlarging this, you can see the cricopharyngeus is located at the level of C6 cervical vertebra. Approximate distance is 15 to 16 centimeter. Arch of aorta, few weeks have also mentioned as 23.5 centimeters, but we will mark 25 as the right answer. And left main bronchus 28 to 30, and esophageal hiatus is approximately 37.5 to 40 centimeters. So we have got arch of aorta is the most correct answer here. Okay. So right main bronchus is not forming any constriction, so it is wrong. Cricopharyngeus is lying at 15 centimeters only, so it is wrong. Diaphragmatic opening of the esophageal diaphragmatic opening is lying much lower, so it is also not the right answer. So after this, I would also like everybody to know that esophagus is altogether 25 centimeters in length, extending from C6 cervical vertebra to that of T11 vertebral level. So yes, any of the students has got any doubt, they can ask me. Let's move on with the second MCQ. Which of the following is a primary lymphoid? Many of the students has told me about this MCQ, that there was a direct question, and whenever I take a histology session, I always tell you that for the histology session, you have to know the example of secondary lymphoid structures and primary lymphoid structures, and you have to know the histological identifying features of these histological structures. So which of the following is a primary lymphoid organ? अगर हम primary lymphoid organ की बात करें तो most correct answer will be thymus gland. Okay, so actually bone marrow is not given here. Tonsil, tonsil, lymph node and spleen are not the right answer because they are secondary lymphoid organs. They are secondary lymphoid organs. Okay. Now the next thing is that I would also like everybody to quick revise the definition of primary lymphoid organs and the secondary lymphoid. Whenever I am telling that whether a structure is primary or central lymphoid organ, I mean to say that these have got a stem cells for the process of lymphopoiesis, and they are involved in immunocompetence and to the lymphocyte. So basically we have got bone marrow, and basically we have got the thymus gland as the primary lymphoid structure. If I talk about secondary or peripheral lymphoid structures, they are mainly tonsil, lymph node, spleen, malt, mucosa associated lymphoid tissue. So actually these are the most correct answer here. So basically, if I am going to mark it as a right answer, I will definitely go with the correct answer as the thymus gland. Okay. So done with this. So let's move on to the let's move on to the next question, which has been asked in the examination. So let's discuss it. So actually it was an image based question. So the students told there was something slide of a lymphoid slide of lymphoid was not given. It was a direct question, but a slide of thyroid was given. Okay. And how we are knowing this is a thyroid gland slide? Because these are what? These are colloid. These are colloid, which is seen, and we have got so many follicular cells. These are all follicular cell, but the question was not about follicular cells and colloid, but these are the indication which will help you to understand this particular slide is of thyroid gland. How we are knowing this is a slide of thyroid gland? We are knowing that this is a slide of thyroid gland because the lining of the thyroid follicle is by simple cuboid epithelium. In the secretory phase, it can be simple columnar, but the basic and the crux point to identify the slide is the presence of colloid, which contains thyroglobulin. Now, here you can see lighter stain structures, and the arrow was marked on a lighter stain structures, which was not exactly the follicular cell. They are parafollicular cells. So what will be the arrow mark structure? Identify the arrow mark structure. And here, if I have to identify the arrow mark structure, it is not colloid, it is not follicular cell. The slide is of thyroid gland, and the correct answer will be parafollicular cells. Is it okay, students? So you have marked it right. The correct answer will be parafollicular cells. Any of the students wants to add on? If there were some other options or some other slide or some other questions being asked, you can just write in the chat box. Okay, now let's move on to the, before moving into the next one, if this question has come, I would like to slightly describe it. What is parafollicular cells? So parafollicular cells are also called as C cells. अगर हम parafollicular cells की बात करें तो it is also called as C cells, and they are neuroendocrine cells found in the thyroid gland. How we are going to identify it? They are larger and pale in stain. If we compare the staining characteristic feature for the follicular cells and that of parafollicular cells, the parafollicular cells large and pale in staining as compared to follicular cells. They are lying adjacent to thyroid follicles. They reside in the connective tissue, and the primary function is to secrete calcitonin. So that is the hints. Now here I would like to show you another image where you can definitely, this is 40x power, this is high power view. In this high power view, you can see the location and you can appreciate that the lighter stain structure is the parafollicular cell, which is lying in the interfollicular stage. They are lying, basically they are situated in the basement membrane surrounding the follicle cells. So parafollicular cell are larger than the smaller size follicular cells, pale in staining, are typically situated basally in the epithelium and are not directly communicating with the follicular lumen. So the right answer here will be parafollicular cells. Done? Any students not understanding anything or any doubt, they can ask me. Okay, so we have done with this. Now let's move on to the next one, that is if I talk about the fourth MCQ related to the anatomy, so the students were telling there was some question related to sixth arch artery, or there was some question related to ductus arteriosus. So I am going to explain both of it. Okay, particularly options नहीं पता चल पाए, but मुझे ये information थी कि ये there was something related to sixth arch artery and ductus arteriosus. So if I talk this table so many times I have discussed. I have told you that pharyngeal arch artery is a very important topic, has been asked several times in the previous year of examination, and a quick revision is important for you. So अगर हम sixth arch artery की बात करते हैं, if we are talking about the sixth arch artery, the correct answer will be on the, it is forming right and left pulmonary artery and a part of it forming ductus arteriosus. So that means both is related to sixth arch artery. On the left side, the aortic arch 6 persists as ductus arteriosus, which in the adults form ligamentum arteriosum. Ductus arteriosus will form ligamentum arteriosus, and the left recurrent laryngeal nerve hooks around the ligamentum ductus arteriosus. That means it is hooking around the ligamentum arteriosus. And already we have discussed first arch artery, portion of maxillary artery, stapedial and hyoidal artery is the second arch artery. Right and the left common carotid artery portion is the third artery, and also right and the left internal artery. If I talk about fourth arch artery, it is taking part in formation of the part of the arch of aorta, and the fifth arch artery regresses. So it is very important that you should be revising all these. This has been asked several times in the previous year of NEET-PG exam also, or FMG में भी पूछा गया. Okay. So any doubt you can also ask me. Actually, some of the students were telling no, there was a question related to the embryological origin for arch of aorta. So we already know, अगर हम arch of aorta की बात करते हैं तो left fourth arch will form a part of arch of aorta, and exactly left fourth arch will form a part of arch of aorta located between the left common and left subclavian artery. Right fourth arch artery will form the part of right subclavian artery, and that part which is extending till the level of origin of internal thoracic artery, which is a branch from first part of the subclavian artery. Okay, तो both way, अगर हमने बात की है sixth aortic arch, so we are knowing it is related arteries, and ductus arteriosus is the right answer. Sixth arch artery part of it is also giving to the portion of pulmonary arteries. अगर arch of aorta है तो left fourth arch artery correct answer होगा. But I think few of the students also told me that there was a question not for the nerve. It has been asked about the sixth arch artery and the nerve. So for question number fourth, I have given all the possibilities which could be has been asked. So अगर हम nerve of sixth arch artery की बात करते हैं तो again this is a question of embryology, head and neck series, and the correct answer will be the recurrent laryngeal nerve. क्या होगा correct answer? Recurrent laryngeal nerve. So ये बहुत easy था. So exactly, I just want everybody to have a quick revision of the, so I'm just enlarging this, and you can see a quick revision of the arches. So if I'm talking about the nerve of first arch, so it is the nerves are mandibular and maxillary nerve, branch of trigeminal nerve. The muscles of first arch are the muscles of mastication, temporalis, masseter muscle, medial pterygoid, lateral pterygoid, one muscle of the ear, that is tensor tympani, tensor villi muscle, and anterior belly of digastric. अगर bones and ligaments की बात करते हैं तो malleus, incus, phenomandibular ligament. Now coming to the second arch nerve. Second arch nerve is facial nerve. I would add on here actually coda tympanic nerve, which is a pre-traumatic branch of facial nerve, is the part of first arch artery only. First pharyngeal arch derivative. Okay. Now, if I talk about facial nerve is the nerve of second arch, the muscles derived from the second arch, the correct answer will be stapedius, stylohyoid, posterior, all the muscles of facial expression. So, all the muscles, zygomaticus major, minor, risorius, mentalis, levator-labile superioris, levator-labile alegnesi, many muscles are there. All the muscles are in the facial region, which is an example of muscles in the superficial fascia fat. That muscles group are called as panniculus carnosus. So all these muscles are getting innervation from facial nerve. If I'm talking about the bones and the ligaments which is derived from the facial nerve, the answer is stapedius, styloid process, stylohyoid ligament, and that of the lesser corona and the upper part of the body of hyoid bone. Glossopharyngeal nerve is the nerve of third arch giving rise to just one muscle, and the hyoid bone lower part body and greater corona. Fourth arch nerve is superior laryngeal nerve, and the muscles are constrictor muscles of pharynx and the cricothyroid muscle. All the other muscles of larynx except cricothyroid muscle is the sixth arch muscle, and the nerve is recurrent laryngeal nerve, which was asked in the MCQ. So we have got this. Now let's move on to the next one. So any students is having any doubt, they can ask me. Now there was another question which was an image based question. So I have made this, I have just marked the arrow in this, can you see? So I am just enlarging it. So please appreciate, this is the anterior view or the so from we are seeing the heart chambers from the anterior aspect. So जब हम anterior aspect से heart chambers देखते हैं, तो we can appreciate the black arrow is marked onto the atrioventricular groove. Okay, so we can see that it is marked on one of the groove, and you have to identify the structure lying in this groove. Okay, so vein पूछा है या artery पूछा है, so definitely if we are seeing the anterior view of the heart chambers, we can definitely know that this groove is atrioventricular groove. Okay, this is anterior so this is actually anterior interventricular sulcus. So definitely you can see this is anterior. So arrow is in the interventricular sulcus. Okay, so अभी हम arrow की बात करते हैं, तो अगर ये right ventricle है, see here, this is right ventricle and this is the apex of the heart which is seen. So definitely this is the left ventricle. So that means anterior interventricular groove. What is this? This is anterior interventricular groove. Okay, and अगर arrow anterior interventricular groove में mark था, तो the artery and the vein which is lying here is the great cardiac vein and the anterior interventricular artery. So what will be the answer? I am just enlarging this. This is another image where you can see the correct answer. So we can see this groove is anterior interventricular groove, and we have got great cardiac vein running along with the anterior interventricular artery in this groove. Okay. Now, the cardiac vein, that the great cardiac vein will be the right answer. Agar option mein great cardiac vein hai, to we'll mark great cardiac vein as the right answer, which is running in anterior interventricular groove and sulcus along with the anterior interventricular descending interventricular artery. And exactly, if you will see further down, we can see this artery is circumflex. This is circumflex artery, and where it will run ascends circumflex artery, where it joins with the middle cardiac vein and will drain in the coronary sinus along the left hand side. What is coronary sinus? The largest vein. All the important veins, major veins of the heart will drain into coronary sinus, and coronary sinus will open in the interior of right chamber of the heart, right atrial chamber of the heart. Now, it's also important that the question was actually about anterior interventricular groove, and the right answer was great cardiac vein. But if there was some other vein located or asked in the groove, so you should also revise that. Middle cardiac vein will run in the middle. अगर हम middle cardiac vein की बात करते हैं, तो middle cardiac vein will run in the posterior interventricular sulcus, and posterior interventricular artery is running, and it is joined by great cardiac vein to drain into coronary sinus. अगर हम small cardiac vein की बात करते हैं, तो it is running with the marginal artery and continues with the coronary sulcus, and it drains into the coronary sinus from right side. Okay, ठीक है? So we are now knowing the location of great cardiac vein, small cardiac vein and middle cardiac vein. Definitely इन्हीं तीनों में से कोई भी आपको ऑप्शन दिया होगा या पूछा गया होगा. I think great cardiac vein was asked. One of the student was telling me about that. You can see this is circumflex artery along with great cardiac vein, and this is coronary. What is this? This is coronary sinus. So here I will use blue color for it. So you can see this is the coronary sinus, and we can see here posterior interventricular artery and middle cardiac vein in the posterior interventricular groove. And we have seen the small cardiac vein running with the small cardiac vein here running with that of the that of the right coronary artery. So we have to mark the right answer, and that will be definitely anterior interventricular groove, anterior interventricular artery with great cardiac vein. Okay, any doubt students? Any doubt you can ask me. Now one of the question which I cater, question number 7, we should talk about this question. So if I am talking about question number 7, Surface anatomy of the heart valve. So this is also very commonly discussed. It is also discussed in the physiology session. So this is a question of physiology also. Actually, anatomy can cater the questions from ENT, can cater the question from orthopedics, can cater questions from surgery and from ops and gynae, and also from physiology. So exactly, surface anatomy of heart valves, arrow leads to the surface area of auscultation of which area? So that is aortic, pulmonary, tricuspid, and mitral. So you there was some image based on the, you are knowing the surface projection, and you are knowing the palpation area of this aortic valves as shown in the diagram. So you have to identify. I am exactly, they were not aware to tell which valve was exactly asked, but this is the location. Now, so exactly this area which is shown here is the heart sound, is representing the examination of heart sound. They are not exactly representing the anatomical location of the valves. So अगर हम aortic valve की बात करेंगे, so if I am talking about A, so let me just rub this. So अगर हम A की बात करते हैं, A, that is aortic valve, it is heard onto the right second intercostal space, medial end of right second intercostal space. So this is exactly, this would be have been in the option second intercostal space, right hand side. If we are talking about P, P is the pulmonary valve and it is on the left second intercostal space, medial end. If I am talking about the mitral valve, it is exactly heard over the apex of the heart, and we know apex of the heart lies in the left fifth intercostal space at the mid clavicular line. If I am talking about T, the tricuspid valve is heard at the left fifth costal space, lower into the sternum area. So left of the lower part of sternum area. So I just want everybody to have a look on this image, and just those who want to tell me the options, they can write in the options and they can tell me, yes, exactly, this is exactly the location of valves as mentioned on the anterior aspect. So you can just, this is what this you can correlate what was exactly asked as the option which was not given by the students. Okay, is it okay? So yes, let's move on to the next question. So question number 8. After surgery, actually one of the questions student was telling shrugging of shoulder पे एक question आया था. तो shrugging of shoulder actually जब मैंने session लिया था तो I have made few clinical questions on this topic, because this is very importantly has been asked in previous year of INI-CET exam, previous year of NEET-PG में पूछा गया था, previous year of FMGE exam में भी पूछा गया था. तो after a surgery which is done on the right side of the neck, a person could not raise his arm above head. यानी कौन सा मूवमेंट अफेक्टेड है? ओवरहेड एबडक्शन. क्या अफेक्टेड है? ओवरहेड एबडक्शन. The movement which is affected is overhead abduction of the shoulder, and after that the patient is not able and could not shrug the shoulder also. So what is the probable cause of this condition? Paralysis हुआ है trapezius muscle का, injury axillary latissimus dorsi, या paralysis of deltoid. Students has told me कि deltoid was one of the option given. Actually the correct answer is trapezius muscle, because what is the reason that trapezius muscle is the correct answer? Because trapezius muscle, अगर हम trapezius muscle की बात करेंगे तो trapezius muscle along with serratus anterior muscle is involved in overhead abduction. It is involved in overhead abduction of arm. ठीक है? और यहाँ पे shrugging of shoulder is an action of trapezius muscle, और injury का जो level है वो posterior triangle of neck में. So when I was taking the session of head and neck, I told you दो questions इससे form हो सकते हैं clinical. अगर serratus anterior option में रहता या injury to long thoracic nerve रहता, तो clinical history different होती. क्या होती clinical history? The clinical history was there must be injury in the axilla, or there will be something, some surgery done for the removal of the breast, operation like radical mastectomy, and the injury of nerve has happened. Such kind of history is not provided. Such kind of option is also not there. The history is of surgery on the right side of the neck. That means there is surgery done in which area? In the posterior triangular area of the neck. ठीक है, ये तो क्लियर हो गया. पोस्टीरियर ट्रायंगल ऑफ द नेक में सर्जरी की गई है, और as we know that roof and the floor of posterior triangle is formed by investing layer of deep cervical fascia, and floor is formed by prevertebral layer. So we have got spinal accessory nerve which is running between the roof and the floor. What is the course? It is exactly running between the roof and the floor, and it is sandwiched between the roof and the floor layer, and there is chance of compression in between this layer. And when the spinal accessory nerve is injured, the muscle supplied by spinal accessory nerve is trapezius and sternocleidomastoid. So we'll mark trapezius as the right answer. Definitely axillary nerve is not the right answer, because that will damage the deltoid muscle, and deltoid muscle is not causing overhead abduction, it is causing abduction from 15 to 90 degrees. Latissimus dorsi is also not the right answer. Latissimus dorsi is mainly causing extension, medial rotation of arm, and paralysis of deltoid is already not the right answer. So we'll mark trapezius muscle as the right answer. Now, spinal accessory nerve is injured in this case, that will lead to the paralysis of trapezius muscle, and we know the shrugging of shoulder, overhead abduction is the function and action of trapezius muscle. So got it, dear? Now, I would also like to discuss the next question, that is question number 9 with you. There was one of the another questions, which is embryology clinical question, and that was related with improper closure of posterior neural pore. So, बच्चों ने बोला there was spina bifida सा एक question था, तो I think there must be something written about the improper closure of posterior neuropore. And when I have taken the session of neuroanatomy and embryology part, I have told you about the time and days when the anterior neuropore closes and when the posterior neuropore closes, and what will happen with the defect related to it. So अगर हम posterior neural pore दिया है, तो right answer क्या होगा? Spina bifida होगा. Okay, I don't know other options क्या था. Anencephaly था, तो that is not, because that is leading to the deformity of anterior neural pore improper closure. ओके, डैंडी वाल्कर मालफॉर्मेशन और फीटल अल्कोहल सिंड्रोम नहीं होगा. फीटल अल्कोहल सिंड्रोम से हार्ट इंटेलेक्चुअल conditions of the baby will be affected. That's Dandy Walker malformation में there will be abnormality into the openings of the roof of fourth ventricle. Such kind of history will be there. So the correct answer will be spina bifida. Now, अगर स्पिना बाइफिडा होता है, तो properly we have got spina bifida because of the reason of posterior neuropole non closure or defective closure. It can be of 4 types. The first is spina bifida occulta. So actually this is the mildest form. This is the mildest form. Failure of vertebra is just not closing, and there will be hair, skins and tufts seen in the often evident in this case. अगर हम दूसरी वैरायटी की बात करते हैं, meningeocele, that is called spina bifida cystica, meningeus covering will also be protruding out. You can see not only this, the meningeus covering is also protruding out, and the next variety is meningeomyelocele. In this is severe condition, वहां पे meningeus और spinal cord both is protruding out, the most severe form. So एक बार INI-CET एम्स एंट्रेंस एग्जाम में इमेज बेस्ड क्वेश्चन था, जिसमें कि हमारे पास एक इमेज था वेयर द न्यूरल ट्यूब इंटायरली विल बी विजिबल आउट, एंड दैट इज द severe form of spina bifida, that is called as myelocysis. So you can see rachis, whole of the neural tube is exposed out. But I think the question was about spina bifida occulta, and you can mark spina bifida as the right answer. So done with this, my dear students. Let's move on to the next. So actually, one of the question in the gynae, it was asked about spina bifida, and there we have to know this defect occurs due to improper intake of vitamins. So we know that we should take maternal folic acid deficiency will lead to this. Okay. So this was question from the gynae. Alpha fetoprotein is found in amniotic fluid and maternal serum. It is indicator of neural tube defect like spina bifida and anencephaly. If AFP, alpha fetoprotein levels are reduced, the mother of the fetus can be suffering from the Down syndrome. Okay, so this was one of the question about folic acid intake related to it was also asked in the examination, and this was asked in the gynae and ops paper. Now, you should have a quick revise of anterior या क्रेनियल न्यूरोपोर की क्लोजर की बात करते हैं, तो एंटीरियर क्रेनियल न्यूरोपोर क्लोजेस बाय डे 25 और पोस्टीरियर इट टेक्स 2-3 days later it closes. Posterior neuropore closes by day 28. Okay, got it everyone? Now we will so question number 11. Now I would like to discuss next question, that is question number 11. Image is showing the action of which muscle? The option given here is quadriceps femoris, adductor magnus, abductors of the thigh, and hamstring muscle. So we have got four options here. Actually students bol rahe the ki there was something related with the action of the muscle which has been asked directly. ऐसे ट्रेंडलेनबर्ग टेस्ट या नर्व नहीं दिया तो ऑप्शन में, तो अगर आपको याद हो, आई हैव डिस्कस ऑलरेडी इन टेस्ट एंड डिस्कशन पार्ट कि action of the muscle being involved. So we know that gluteus medius and minimus are abductors of hip, and if there is an injury of superior gluteal nerve, the abduction of hip is affected and it will lead to Trendelenburg test positive, Trendelenburg sign positive. So here you can see exactly, I will show you the image. If there was some image like this, I have taken this image, and I feel that if it was an image based, because students were telling image based question tha, तो वहां पे if you stand on one leg, if a person stand on one leg, the other side of the hip is slightly raised upward by the action of antagonists, the other side, contralateral side of abductors of the hip. If the superior gluteal nerve injury is there, you can see the other side of hip is not lifted up, but it is sagging down because of the paralysis of abductors of other side. So definitely the correct answer is abductors of thigh. That means gluteus medius and minimus are paralyzed due to injury of superior gluteal nerve. Okay dear, यहाँ पे क्या इंजुरी होगी? superior gluteal nerve की. Now Trendelenburg sign, the loss of abduction function is gone because of the paralysis of gluteus medius and minimus, and the injury of the nerve is superior gluteal nerve. So the stabilization of pelvis when you stand on one leg is not done. So this is very important that you should understand so many times. This is direct repeated questions of NEET-PG and INI-CET exam. FMG में भी पूछा गया, और this clinical question has been asked several times. So please, I think most of you have marked it as a right question. Okay. So let's move on to the next one. Question number 11. So this was the same. अगर ये भी हो सकता है, language of question will be positive Trendelenburg sign, then you have to mark abductors of thigh as the right answer. Got it? Now the next is actually one of the question which the students were telling, and in the telegram group they have discussed. There was some question related to the chest pain, and what was marked here, the chest pain was radiating on the medial side of arm. Chest pain kahan radiate ho raha hai? Medial side of arm. So actually this is a very good question, and in the clinical aspect, when I was discussing about the axillary lymph node group, I have told you that actually what happens, there is one nerve. Okay, there is one nerve, that is intercostobrachial nerve. अगर intercostobrachial nerve option में था तो आपको intercostobrachial nerve mark करना है. अगर splanchnic nerve नहीं था, thoracic splanchnic nerves नहीं था, so you have to go definitely with the intercostobrachial nerve. Medial aspect of arm में radiate होता है pain, anterior aspect of chest pain, because of intercostobrachial nerve, branch of second intercostal nerve, which is communicating with medial cutaneous nerve of arm. So actually in breast cancer patients, if intercostobrachial nerve is compressed by central lymph node enlargement, it can lead to pain in the medial aspect of arm. एक तो ये clinical history है. दूसरी clinical history जो आपको मिलेगा MCQ में, वो होगा pain है आपके chest में, वो medial aspect of arm में radiate हो रहा. That is also the right answer. Medial aspect of arm में radiate होने की बात की गई है. That means medial cutaneous nerve of arm is communicating with intercostobrachial nerve, and mark intercostobrachial nerve as the right answer. So you can just see there. I want you to explain this. यहाँ पे हम second intercostal nerve देख रहे हैं. Branch of it is intercostobrachial nerve, and you can clearly see in this image that it is communicating with medial cutaneous nerve of arm. So that is the reason there will be pain in the medial aspect of arm. I would also like everybody to see this cadaveric image. So everyone, have a look on this cadaveric image. So अगर हम ये cadaveric image देखेंगे तो we can see here the intercostobrachial nerve. I am highlighting intercostobrachial nerve, and you can clearly see this intercostobrachial nerve from the chest. It is mediating towards the medial aspect of arm. It is communicating in the medial arm via medial cutaneous nerve of arm. Got it? Now, intercostobrachial nerve is a source of cardiac pain. Intercostobrachial nerve sometimes also get affected in the axillary lymph node involvement for breast cancer surgery, and it can lead to pain in the medial aspect of arm. So we will mark this as the right answer. Done. Now let's move on to question number 12. Okay, one of the question, very important question, so many times I have discussed. The clinical history was given and you have to identify the nerve injury which is causing hyperextension of metacarpophalangeal joint and flexion of interphalangeal joint of ring finger or little finger. You have to identify whether radial nerve is involved in this case, whether ulnar nerve is involved in this case, where anterior interosseous nerve is involved in this case, or posterior interosseous nerve. So this is a question of claw hand. See here. This is. So exactly अगर complete claw hand होता है, if there is complete claw hand, that means the patient is having injury of both median nerve and ulnar nerve. अब ये आपको बताना है कि medial aspect of fingers involved था या पूरा claw hand था. There was a case of complete claw hand. So अगर medial aspect of ring finger and little finger is involved, the correct answer will be ulnar nerve. Now we know that the action of lumbrical muscles assisted by the interossei muscle is this. What is this? In this case, there will be flexion at the metacarpophalangeal joint and interphalangeal joint is extended. But if there is injury of the nerve supply of these muscles, we know that lateral lumbrical muscles are getting innervation from median nerve or medial lumbricals are getting innervation from ulnar nerve. So if these muscles are paralyzed, just a reverse will happen. यहाँ पे medial claw hand होगा. Why? Because only ulnar nerve is involved and medial little finger and ring finger is involved. There will be flexion of interphalangeal joint and extension of metacarpophalangeal joint. ठीक है? Everyone, I think most of you must have marked it as a right question, right answer. Now, claw hand is caused by a lesion. Actually, either it can be like this. The option में हमारे पास median nerve भी है, ulnar nerve. In that case, you will definitely go with ulnar nerve as the right answer. Why ulnar nerve? Because more commonly, the ulnar nerve root value C8 and T1 bracket में C7 mainly C8 and T1 nerve is involved and medial claw hand is more common than lateral claw hand. So जब भी हम claw hand की बात करते हैं तो the first thing which come in mind is ulnar nerve. So ulnar nerve will be the right answer. Both options are given. Definitely radial nerve तो होगा ही नहीं because it will lead to wrist drop. Axillary nerve होगा ही नहीं because it will lead to paralysis of teres minor deltoid muscle. So posterior interosseous nerve will cause the paralysis of all the deep muscle, all the extensor group of muscle except brachioradialis, extensor carpi radialis longa. Anterior interosseous nerve is the deep branch of median nerve and it is giving innervation to deep muscle of the flexor forearm compartment and that muscles are pronator quadratus, flexor pollicis longus and the lateral part of flexor digitorum profundus. So my dear student, you can write your messages in the live chat box. After that also you can more contribute in remembrance of the questions being asked for FMG July session and I will be very pleased to solve it. So I can come once again with the proper options and description of the question being asked in the examination. So we will take another 2-3 days and again I will come with the proper explanation. I have tried my level best to cater almost all the questions being asked for the July FMG examination. Let's move on to the next, that is question number 30. ओके ये तो डायरेक्ट रिपीट हो गया. ओके ये तो डायरेक्ट एफएमजी क्वेश्चन का रिपीट हो गया. आई थिंक 100% स्टूडेंट्स मस्ट हैव मार्क्ड इट राइट बिकॉज दिस क्वेश्चन आई हैव इंक्लूडेड इन आवर टेस्ट सीरीज आल्सो. In the given image, which of the following artery is being palpated? Whether the artery being palpated is anterior tibial artery, posterior tibial artery, dorsalis pedis artery, or the popliteal artery. So what we can see here that exactly you can see the palpation is done in relation to the medial malleolus posterior. The correct answer is posterior tibial artery and most of the students has given the right answer. So exactly अगर हम posterior tibial artery की बात करते हैं, so it passes between the medial malleolus and the heel bone. Heel bone is called as calcaneus bone and exactly यहीं पे palpation किया गया है. So the correct answer is posterior tibial artery. In this case, you can see the posterior tibial artery which is traversing beneath the flexor retinaculum, beneath the flexor retinaculum of the ankle foot. Okay, and exactly हमने बात भी की थी, the doctors are not here, are the structures which is passing beneath the flexor retinaculum of the foot and posterior tibial artery is definitely traversing beneath it. So we will mark posterior tibial artery as the right answer. Now one more question was there in which the transverse section, the cross section of the abdomen showing the peritoneal reflections has been seen. So and you have to mark the arrow marked image. Few students was telling that question was about gastrosplenic ligament. Few students was telling the question was about lienorenal ligament. Identification and the structures contained. Don't worry, हम वो सारे explain कर देते हैं. So let me just enlarge this. Okay. So this is the transverse section of the abdomen which has been shown and for this I have marked white arrow in one of the ligaments which you can see. Now I will give you a hint. Agar I exactly don't know what was the image given, but there was a transverse section of the abdomen. So यहाँ पे this is clear that this is the posterior aspect of the transverse section, and this will be anterior, no doubt about this, my dear. Why? This will be left hand side and this will be right hand side, no doubt about this. Why? Because we have got stomach here, we have got liver here. This is the vertebra, so definitely vertebra तो posteriorly होगा बच्चे. यहाँ पे हमें मिला है stomach, and this will be the left kidney. ओके ये लेफ्ट किडनी होगा और ये क्या होगा, राइट किडनी. सो अभी हमें इतना कुछ पता चल गया, तो इट्स वेरी इजी फॉर अस टू आइडेंटिफाई द पेरिटोनियल रिफ्लेक्शंस इन द लिगामेंट. इज इट ओके डियर स्टूडेंट्स? सो वेरी नाइसली वी कैन appreciate this. Now if you will see, so exactly ये arrow mark ligament के बारे में पूछा गया था क्वेश्चन में, and definitely the arrow mark ligament in this case is connecting is exactly, if we talk about, so sorry ये तो मैंने stomach and this is the spleen, so sorry, okay, this is the spleen. So this ligament which is connecting stomach and spleen will be gastrosplenic ligament. So this is gastrosplenic, and the arrow mark ligament which is connecting here left kidney and spleen is lino-renal ligament. वो कौन सा ligament है? Lino-renal ligament. अगर arrow या तो gastrosplenic ligament में marked होगा तो वहां पे arrow यहाँ पे होगा, this ligament पे होगा which is connecting stomach and the spleen. And if the white, as for example in this image मैंने white arrow mark किया है spleen और stomach में, so that will be lino-renal ligament. So here you can see the image, you can identify FC for falciform ligament. As you can see, lino-renal ligament LR, GL is the gastrolinal or gastrosplenic ligament. GL means gastrorenal or gastrosplenic or gastrolinal ligament. This is lino-renal ligament. You can also appreciate the inferior vena cava aorta, the vertebrae, the lesser sacs. So exactly the correct answer you can know with this transverse section, and I think lino-renal ligament was asked, or if gastrosplenic ligament was asked, you have to also know the content of it. So अगर हम gastrosplenic ligament के content की बात करते हैं तो it contains short gastric arteries and the left gastroepiploic artery. If I am talking about the lino-renal ligament, it contains splenic artery, splenic vein and tail of pancreas. Got it? So you are going to mark it right answer. Any doubt, you just go through this image and the contents. Now, one of the question which was asked for neuroanatomy was the level of crossing of corticospinal fibers. Actually 2020 या 2019 में एम्स entrance exam में पूछा गया था. That was pyramidal decussation के idea. So arrow was at the level of pyramidal decussation, and we know that pyramidal decussation will lead to contralateral paralysis and hemiplegia, and this pyramidal decussation will happen at which level? At the lower aspect of the medulla. So definitely the decussation of pyramidal tracts occurs in the brainstem, and the decussation of pyramidal tracts takes place before the junction with the medulla and the pons. It is in the lower part of the pons. So this will be the right answer. Lower part of the medulla oblongata will be the right answer. Okay, my dear students, let's move on to the next. Okay, this was the question from general anatomy, and I have given you a huge list of all the examples of synovial joint, different variety, all the example of cartilaginous joint, all the example of fibrous joint, sutures and all, syndesmosis, everything we have already told. So joint which is formed between the part of the growing bone, that is the epiphysis and diaphysis, the correct answer will be synchondrosis. Symphysis nahi hoga because it is secondary cartilaginous. Fibrous nahi hoga. Obviously, fibrous joints are mainly the joints in the sutures and all skull. Plain synovial joint nahi hoga because that will have like intercarpal, intertarsal, acromioclavicular joint. These joints are actually the type of plain synovial joint. Synchondrosis is the right answer. कुछ बच्चों ने ये भी बोला था synostosis was one of the option. No, this is also not correct because that is bony fusion. So we'll mark synchondrosis as the right answer. Now, few students told me there was one question about the first carpo-metacarpal joint of thumb and type of joint. This is the easiest one, I think. अगर सबने इसको सही मार्क किया होगा because I have included these questions in the discussion of test of anatomy, and the right answer is saddle type of joint. What will saddle type of sign? The carpo-metacarpal joint is a saddle type of joint, and it is articulation between the base of first metacarpal, that is of the thumb, and that of trapezium. Now, another question for the histology lining epithelium. I have given you a huge list scattered from multiple books, the examples of all types of epithelium. This is again a easy one. What will be the lining epithelium of trachea? My dear students, the lining epithelium of trachea is, I already told you, what is respiratory epithelium. अगर हम respiratory epithelium की बात करते हैं तो respiratory epithelium is pseudostratified ciliated columnar epithelium. So this is again a direct question, and I think most of the student must have marked it right. That is pseudostratified ciliated columnar epithelium. ठीक है? Pseudostratified ciliated columnar epithelium. Got it, dear? Pseudostratified ciliated columnar epithelium. This is the lining epithelium of trachea. ठीक है? Ciliated columnar नहीं होगा. That is lining epithelium for fallopian tube and like ependyma and all. Simple columnar nahi hoga, that will be in colon, small intestine, GI tract. Squamous non-keratinized will be in esophagus, vagina, anal canal. So definitely the right answer is respiratory epithelium, pseudostratified ciliated columnar epithelium. This is the histological image which I want you to show. Here you can see these are cilias which has been shown for moving out the dust particle not entering into the upper lower respiratory tract, ciliated pseudostratified columnar epithelium, that is of respiratory epithelium. Now, one of the question was about hepatic segment. We have to identify which, the question was about choanid hepatic segment, and you can identify the hepatic segment. Actually, this is again a very important question being asked in the previous year of examination also, and you should be able to identify. So I just want everybody to concentrate on this image because it's important to understand the segments. There are 8 hepatic segments and you have to know how these 8 segments has been divided. What is the criteria? Because these are functional segments, these are not anatomical segments. So for that, choanid classification is used, and choanid classification is dividing the lobes of liver into 8 segments. A transverse plane is passing at the bifurcation of the main portal vein, and thereafter the segments are arranged clockwise manner, starting from which lobe? Starting from the caudate lobe. Now I just want, there are 4 lobes of the liver and each of the lobe is again divided for 8 segments. So this is independent segment. In the center of each segment there is a branch of portal vein, hepatic artery and bile duct, and the periphery or the vascular outflow of the periphery is done by hepatic veins. So this is the definition and how the hepatic segment has been formed. And if there is something else asked, if they have asked about identification of the segment and location, so this is a quick recapitulation of it. एक side हमने right lobe देखा है और दूसरे साइड लेफ्ट लोब ऑफ द लिवर भी है. तो आपको जानना है राइट पोस्टीरियर सेक्शन, राइट एंटीरियर सेक्शन, मिडियल posterior section. You can have an idea of the segment, hepatic segment identification for all the lobes of the liver. So this can either be image based question or the criteria of classification, and this is how we are doing it. Okay, so just have a quick recapitulation of it. अगर आप मुझे options बताओगे और exactly क्या पूछा गया था, then I can frame the question also. But there was one question about hepatic segment, so I have given you a quick recapitulation about hepatic segments. One more question was about motorcycle accident हुआ और उसके बाद मेटाकार्पल phalanges fractures हुआ और हाइपोथिनार मसल्स की एट्रोफी हो गई. हाइपोथिनार. सो द क्रक्स पॉइंट जिसपे हमें यहाँ पे जो हमें यहाँ पे ध्यान देना है वो क्या है? हाइपोथिनार. यहाँ पे क्या है? हाइपोथिनार मसल्स की एट्रोफी होगी. ठीक है, hypothenar. So exactly we know that hypothenar eminences here is formed by hypothenar muscle which is consist of abductor digiti minimi, opponens digiti minimi, flexor digiti minimi. So these are the muscles which is forming the hypothenar eminences, and if there is an injury of hypothenar eminences, that means ulnar nerve is definitely injured. So that means ulnar nerve is right answer. Radial nerve is not giving any kind of innervation in the hypothenar. Musculocutaneous nerve is giving innervation to BBC, biceps brachii, brachialis, and that of coracobrachialis. Medial nerve, so definitely they are the they are giving innervation to thenar muscle, not the hypothenar muscle. ठीक है? क्यों ulnar nerve right answer है? पता चला? Now let's see. Ulnar nerve is formed from the root value of C8 and T1. It is not giving any muscles innervating in axilla and arm. It is innervating 2 muscles in the forearm. What are these 2 muscles? FCU and FDP medial part, and it is basically giving innervation to many muscles of the hand, intrinsic muscles of the hand, except lateral to lumbricals and the muscles of thenar region. So hypothenar region is definitely innervated by ulnar nerve. It also gives sensory innervation to medial 1.5 of the fingers and the palm and dorsal aspect of medial 1.5 finger. So definitely we have got the right answer dear. Okay, any doubt students, any doubt you can ask me. So ulnar nerve is the right answer. Is it okay? So we'll mark ulnar nerve as the right answer. Got it everyone? Now moving to the next question. Moving to the next question, that is question number 21. Patient is falling on an outside. Actually, this question is also a question of orthopedics, but it's also related to anatomy. So why not solve this? Patient falling on an outstretched hand presents with a fractured displacement of base of first. So यहाँ पे जो crux point mentioned है, fracture displacement of base of first metacarpal, base of first metacarpal. So यहाँ पे क्या इन्वॉल्व है? बेस ऑफ फर्स्ट मेटाकार्पल इन्वॉल्व है और ऑप्शंस जो दिया गया है बेनेडिक्स, स्केफॉइड, रोलैंडो एंड कॉलीज. ओके, सो वन बाय वन आइदर यू कैन गो टू द राइट आंसर. एक्चुअली मेजर जो डाउट है वो रोलैंडो फ्रैक्चर और बेनेट्स फ्रैक्चर में. एक्चुअली बेस ऑफ फर्स्ट मेटाकार्पल इज इन्वॉल्व इन बोथ, बट रोलैंडो इज अ मल्टी, it's not a single damage, it's a means multiple fractures lines हो सकते हैं. So we will go with Bennett's fracture as the right answer. Actually जितनी भी history होती है पेशेंट आउटस्ट्रेच्ड हैंड में ही फॉल करता है, स्केफॉइड में भी फ्रैक्चर होता है, बट the area being involved is giving us the characteristic right position, that base of first metacarpal. Scaphoid will rule out only because base of first metacarpal is already written, or colis तो obviously distal radius is involved, so that is not the answer. So हमारा जो doubt है वो Bennett's और Rolando में. Let me tell you. So this image, this radiological image जो हम दिखा रहे हैं वो क्या है? Bennett's fracture. Red color arrow is on the Bennett's fracture. Can you see base of first metacarpal is involved and broken finger is involving the base of first metacarpal that can extend into carpometacarpal joint also, but we will mark this as the right answer because multiple fracture lines is not located. Also dislocation hua hai, so definitely fracture of thumb, dislocation of some degree or subluxation is related with Bennett's fracture. ठीक है, एक और क्वेश्चन था जिसमें कि रोलैंडो फ्रैक्चर हमने नहीं मार्क किया बिकॉज इट इज एक्चुअली कम्यूटेड फ्रैक्चर्स है. इसमें कम्यूटेड फ्रैक्चर्स यू कैन सी दिस इज आल्सो इन्वॉल्विंग द बेस ऑफ फर्स्ट मेटाकार्पल, but it is actually intra-articular commuted fractures, and so we will not mark this as the right answer. Colles fracture is definitely not the right answer. As I told you, radius close to the wrist will be also involved in this case, and such kind of history was not given, so we'll mark Bennett's as the right fracture. So my dear student, is it okay? We have done with this. So before ending, so I just want everybody, please don't get disheartened, okay? Because actually exactly question क्या था, exactly क्या option था, this has been done on a recall basis, taken from the students, taken from the discussions. So exactly if you have got any more recalls or any doubt, you can ask in the chat box. I will be very pleased to reply your answers. All the best. Please don't think much. Relax. You have done your best. You have given your best and the result will be positive. Be optimistic about your result. All the best and keep studying. Again, I will meet in the next session. If you want a next session, you can write in this chat box with a proper option and explanation, but I have tried my level best to explain as many as questions which I have catered. So keep on studying. We'll meet in the next session with a proper discussion of all the questions with a proper option. Thank you. Thank you, my dear students. Thank you.